Systemic anti-cancer therapy are drugs that we give to patients with cancer to try and improve their outcomes. Traditionally, it was chemotherapy, but modern drug treatments for cancer are very different than traditional chemotherapy. So to differentiate it from what people imagine when they think about chemotherapy, we use the term systemic anti-cancer therapy. So in breast cancer, it would stretch from hormone treatments such as tamoxifen, aromatase inhibitors, traditional chemotherapies, targeted therapies like trastuzumab, Herceptin, pertuzumab, other HER2 targeting therapies, and there are a number of other pathways which we have drugs that specifically target them. So systemic anti-cancer therapy is to be considered in all parts of a breast cancer journey. It has different benefits according to whether it's early breast cancer or late breast cancer. But we know that in early breast cancer, if the cancer is going to spread, it has done so before it's found. So systemic anti-cancer therapies are used at that time to try and eradicate what we call micrometastatic deposits of cancer. Metastatic means that the cancer is spread around the body. Micro obviously means that it's too small to see on imaging that we have available these days. But to get rid of that cancer, we often use drugs after surgery or even before surgery. A lot of systemic anti-cancer therapy should be used before surgery, certainly in HER2 positive and triple negative breast cancers, because you can then assess the response of the cancer to the treatment and use different treatments if it's not been fully effective. In late stage breast cancer, we use treatments to control the cancer for as long as possible and maintain quality of life for patients with cancer as best as possible. And we've got a lot better over the 20 years that I've been practicing. And we've seen that survival has improved considerably in nearly every type of breast cancer, but also that we're able to maintain quality of life much better with much less aggressive and more targeted therapies. So in breast cancer, systemic anti-cancer therapies are various, perhaps easiest classified according to where they target. So estrogen receptor is a target that we use a lot. Drugs like tamoxifen, aromatase inhibitors, drugs like fulvestrant, and new drugs are being developed against estrogen receptor. Many oral selective estrogen receptor downregulators, which are showing great promise. HER2 is perhaps the next obvious target, and we've got a whole host of treatments that have developed over the last 20 years against HER2, from Herceptin, trastuzumab, as it's otherwise known, pertuzumab, TDM1, Kadcyla, trastuzumab, deruxtecan, Enhertu, tucatinib, lapatinib, and more in development. The other main target for breast cancers are proliferation pathways. Traditional chemotherapy is often considered to be targeting the proliferation of the cancer, but excitingly, there's a new class of drugs called CDK4/6 inhibitors, which have massively changed the outcome and improved the outcome for patients with estrogen receptor positive HER2 negative breast cancer. There are other targets, PD-L1, which is an immunotherapy target used in patients with triple negative breast cancer, PI3 kinase, which is a resistance pathway, which is targeted with drugs like alpelisib. I could go on, but that's basically the essence is you try and find a target and develop a drug against it, and then test it in clinical trials to see whether it's effective or not. So depends, the side effects of systemic anti-cancer therapy depend on what the treatment is targeting. So if you're targeting estrogen, we find that patients suffer from estrogen deprivation side effects. So you might equate that to being side effects like going in through the menopause or into the menopause. So very much the same sort of side effects, because we're taking estrogen out of the system. Targeting HER2 is generally not a major problem in terms of side effects, but because some other drugs can cause damage to the heart, and in the heart, the HER2 pathway is a repair pathway. We have seen some patients having the heart not pumping quite as well as it should. So we have strategies for managing that to maintain treatment as best as possible. Chemotherapy itself has side effects mainly on the blood count and risk of infection. And that's something that people need to be very aware of so that they get to hospital quickly to have intravenous antibiotics if they are unwell in any way. But whatever the systemic therapy, the doctor will talk to you in great detail about the side effects to look out for and how to manage them and what to report.